will y'all check on Dr. Phillips and General Waddell? See if they're coming? I apologize, we're running a little late. They'll tell you how much conversation we just had with all the folks who came out today to meet with us and discuss the challenges posed by this winter storm. Thank you, ma'am. I'm still waiting for Keith. Yep. We're going to get started. First of all, thank y'all for coming out, and I want to start by thanking all the people of Northwest Louisiana and really people all over the state, because this has been a very challenging winter storm. We have more than our fair share of practice as it relates to storms, not a lot as it relates to winter storms, and they are different, and they can last longer, and the impacts that they have are very different. I do want to reiterate that this is a statewide event. We actually have some of the same problems you see in here in the Caddo-Bossier area down as far as south as Lake Charles, and then obviously over to Monroe and in northeast Louisiana as well. So we want to thank all the people who've been working so hard, especially first responders, but beyond that, people who work with water departments and try to make sure that sanitation is done. Folks who are healthcare workers who've been sleeping at their place of employment because it hasn't been possible to go to and from their homes. That's been happening at hospitals. It's been happening at our war veterans homes and other nursing homes across the state of Louisiana. And it sort of reaffirms what we've always known about Louisianans, and that is that we are very good, generous, decent people, and we know how to be good neighbors when we're called upon to do that. And we're seeing that in this situation as well. And I want to tell you, we're gratified, as everybody is, that we're starting to have warmer weather, although we will have a freeze starting in Alexandria tonight. It'll be in Shreveport and Monroe area too, but it won't be the deep hard freeze that we've been seeing. And then it'll continue to warm up tomorrow, and then I think there's going to be another freeze on Monday night. So we're not out of the woods. The challenge we're going to have going forward primarily deals with infrastructure, especially related to water, so that as pipes thaw, that's when you find out how many breaks there are. And the more breaks there are, the more work that has to be done in order to be able to restore the water pressure. Until the water pressure is restored, you can't turn off the boil advisories. And until water pressure is restored, it poses tremendous challenges, especially for our healthcare community. So like this facility, or it could be Christus, it could be Willis-Knighton. And from everything that are obvious, when you turn on the faucet, you want water to drink. You want to be able to flush the toilet, but you also have to be able to sterilize your equipment and clean your linen. But it's also directly involved in administering health care, and that's especially true with respect to dialysis. I was just told, I knew water was an essential component. I didn't know that up to 500 gallons per patient is required. And so I can tell you, for the last several days, our #1 priority has been delivering water, potable water, non-potable water, bulk water, and water in bottles to the affected regions of our state. The vast majority of those missions have been here to the Caddo-Bossier area. I believe we're over 500,000 bottles that's been delivered up to this area, and more than 2/3 of all the missions have been here. As the weather improves and the roads become passable, we're now able to engage more private vendors to bring in water as well. And so this situation, we believe, is going to improve relatively rapidly here. Of course, we're competing against other states who are also trying to buy water right now, principally Texas and Oklahoma. But we're going to be able to source water and get it moved where it needs to be, with the #1 priority being dialysis. Because what we have is people who need dialysis 3 times a week. They typically get that at an outpatient dialysis center. But if they're closed, they're coming to hospitals and to the emergency rooms. And the hospital emergency rooms, as you can see from here, we need to be able to take care of other emergency patients, but they're also challenged with water here as well. So we're going to be making every effort through the Department of Health, working with Dr. White here in Region 7 to make sure that we are taking care of these dialysis centers just as soon as we possibly can. Obviously, a number of other challenges as well. Thankfully, electricity is being rapidly restored. There are not many outages to talk about now. But I do want to warn about a few things that are hazards upcoming. The roads are going to get in better shape throughout the rest of the day than it's going to freeze tonight. There's still going to be water on the roads, and when it refreezes tomorrow, it's going to be black ice. It's not going to be white ice. And so we need people to be patient and stay off the roads tomorrow, at least until it warms up enough that that black ice melts, because you're not going to be able to just look at a roadway and absolutely know that there's ice on it. So want people to be very careful. For anybody out there who is still running a generator to stay warm because you may not have your electricity, please follow all of the safety precautions that are necessary. Keep that generator at least 20 feet away from your home in a well-ventilated area. Never run it inside. You shouldn't run it in a garage or a crawl space or under a window or a vent. And then make sure that it cools off before you refuel it. We have had 2 fatalities from carbon monoxide poisoning in Parish. We have a total now, I think, 5 fatalities related to the storm. And so we need people to be very, very careful. And typically it's during the cleanup from a storm when most people hurt themselves or in fact kill themselves. The cleanup aspect of that is going to be starting over the next few days. So please be very cautious as you get out and start to move again and as you start to clean up. Speaking of moving, I can tell you one area where we can all be thankful right now is that there have been hundreds and hundreds of motor vehicle accidents across the state of Louisiana associated with this winter storm. And as I speak to you, not a single fatality. So I want to thank all of our law enforcement people out there who are working so hard to keep people safe, slow down traffic, get people to exercise due caution. But I also want to thank the individual citizens and motorists because they're obviously doing a phenomenal job. I want to thank the team that we have at the state level. You see many of them behind me, not all of them. We didn't travel that heavy today because, quite frankly, travel is still difficult up here. But I'm very thankful for Dr. Courtney Phillips at the Department of Health. I'm thankful for Colonel Adams, who runs the state police as the superintendent, General Waddell with the Louisiana Army National Guard. We've got Dr. Sean Wilson, who runs DOTD here, and Jim Wascom. General Wascom runs GOSEP for us. But really, I want to thank all the locals who work so hard with these people behind me and with their agencies, because it really does take a team in order to get people's lives turned right side up again after an emergency like we've had. So we just had a very, very good meeting with the mayor of Shreveport, but also the sheriff who runs the Office of Emergency Preparedness for Caddo Parish. But we also had the OEP folks from Bossier and Mayor Lowalker there as well. We had legislators from this area, and then we had representatives from the 3 largest hospitals right here, Chuck Daigle, but we also had Dr. Trawick from Christus and Mr. Brian Crawford from Willis-Knighton. And I can tell you there was a lot of agreement in that room about what the biggest challenge is and the biggest need is. It all revolves around water, accessing it immediately for dialysis patients and for health care, but also increasingly bottled water for people at home. We also have to start making the repairs to the water system so that we can get the water distribution system back up and running and get the pressure the way we need it to be, hopefully lift those boil advisories. And we're going to be sending as much help as we possibly can to make sure that all that happens as soon as possible. And so we do encourage people to be cautious. I'm asking for your continued patience. And yeah, it's people are getting stir crazy. They've been home for a long time. But many of the roads are just now starting to thaw. So we're asking people to stay home and be careful and don't travel unless they absolutely have to. So with that, I'm going to take a few questions before we take off from here.
Governor, what's the status of the delivery of the COVID vaccines to the area?
Yeah. Well, so that's a great question. As you all may know, we typically receive vaccine in-state direct shipments from the manufacturers or to our pharmaceutical wholesale distribution partner, which is actually in this region of our state, on Monday and Tuesday. And we get the vaccine Monday and Tuesday for the week that would end the following Sunday. Well, the vaccines that we should have gotten this past Monday and Tuesday have not yet been delivered, and we're expecting next week's shipment as well. All I can tell you is we were told yesterday by Operation Warp Speed not to expect those shipments to come in yesterday or today, which means that last week's shipment could come in as early as tomorrow. But then right on the heels, because tomorrow is Sunday, right? Right on the heels, we should have another week's allocation, which is actually a larger number of doses, which we're thankful for. What I can tell you is many people's appointments had to be canceled. Not all, but many people's appointments had to be canceled this week. They're going to be rescheduled, and probably are, for the most part, already rescheduled. But for the next 7 or 10 days, we're going to work extremely hard with all our local partners in order to double up and get people vaccinated and then get back into a normal rhythm of vaccinations. I do want to remind people that if you were supposed to get your second dose this week and you weren't able to do that, it's not a problem. Just get your second dose as soon as you can. The recommendation is 21 days on Pfizer, 28 days on Moderna, but it's not absolutely necessary. And you know, you can get, if you go look at the CDC website, it will tell you make every effort to get it before 42 days. And the reason they use 42 days is because the clinical trials established that they're fully effective up to then. But nobody should restart their vaccination series because they're late getting the second dose. Just get the second dose as soon as you're able.
Thank you. When it comes to the repairing of the infrastructure for the city pipes, I mean, what's the plan? What plans do you guys have for that if we experience the same thing next year?
Well, first of all, that question is better addressed to Mayor Perkins. What our plans will be now and next year, should this happen again, and we hope that it won't, is we're going to provide as much help and resources as we can. So we know that from this conversation, by the way, that wasn't the first conversation I've had with the mayor this week, Mayor Perkins. I've been talking to him every day. But they're asking specifically that we try to send them people who can help, because a lot of inspections have to take place. You have to assess the system and figure out how many leaks there are. And some of those leaks are going to be on the public side. Some of those leaks are going to be on the private landowner side. But if you want to restore the water pressure, they all have to be fixed. They all have to be addressed. So having additional people to assess the system, having additional skilled people to actually start making the repairs, and then some additional equipment. So we've already started the process working. We're going to be working with the private sector, with the Louisiana Rural Water Association, but also with other municipalities around the state who haven't experienced the same thing that you have up here, and see how many people we can free up and move in this direction to assist them. Now, what specific steps can be taken after we get this problem resolved to try to better winterize our systems so that this doesn't happen again? I'm just not prepared to go into that today, but I know that that's going to be a conversation and an effort that's going to happen here and elsewhere around the state of Louisiana. And again, I want to make this statement. We've had frozen water systems and pipes and breaks as far south as Lake Charles, Louisiana. It's particularly acute down there because after the 2 hurricanes that struck that area, you have an awful lot of vacant houses and businesses that haven't been repaired or reoccupied yet. And so they have leaks going on there, but they don't have anybody to even report the leaks or to try to get them stopped. So this really is a statewide effort, but the focal point really is here in northwest Louisiana because this area took the brunt of this winter storm.
So in terms of the emergency declaration, how does that directly affect people who, you know, might be without water or power still right now?
Yeah, well, obviously, it's very helpful to get an emergency declaration. I issued one last week in advance of the storm. On Tuesday, I was able to speak to President Biden, and I told him that we would be submitting a request for a federal declaration. We did that on Wednesday. He granted it on Thursday, and it's very helpful. What it authorizes us to do is have a direct federal assistance, means federal agencies here in Louisiana are authorized to do everything they can to help us with this emergency. And, you know, I can give you an example of that. We were talking about dialysis. The VA hospital here actually has its own water system. And so it's better situated to take some dialysis patients, and they've actually stepped up, worked with other hospitals, and they're offering dialysis to non-veterans. That's an example of the help that we get. The other thing that we have available to us is Category B, which is emergency protective measures. And that's at a 75-25 reimbursement, 75 cents from the federal government. You know, but in terms of delivering water here right now, we've already been in the process of doing that for several days, and that's going to continue. The declaration allows us to be reimbursed 75 cents on the dollar, for example, and then we're going to be working going forward to see whether the amount of damage here justifies a major disaster declaration, as the president just granted to Texas, for example, and I can't comment yet on whether we will or won't, but we're going to ascertain whether we have a good faith argument to make, and if so, we will make it, and if that turns on, then you potentially have public assistance available that could help the municipalities with these water system repairs. We're not there yet. I don't know the extent of the damage in terms of dollars and whether we're going to meet the threshold necessary, but that's what we're going to be looking at, and also surveying all the parishes that have sustained damage to see whether there might be some individual assistance that we can turn on. All of this requires the federal government to agree to those areas of relief, but that's what we're engaged in now. General Wascom, is there anything we need to add to that?
No, sir.
Okay. Thank you.
Governor, does that assessment trigger the arrival of FEMA to this area of the state?
Well, I'm going to let General Wascom answer that. I do want to tell you that FEMA has been embedded with us in Louisiana. Well, I'm in my 5th year as governor. I really believe they've been with us in Baton Rouge the whole time I've been here, and they're there right now. And FEMA Region 6 is headquartered in Texas, and Tony Robinson is the administrator. We talk to him all the time as well. And I just want to tell you that FEMA is always in Louisiana. It's a function of our hurricanes and floods, and now winter storms. And the communication there is good. And we actually work with them very, very well, so that our FEMA representatives know when we're going to be asking the president for assistance, so that they can lean forward and actually, as soon as he turns it on, they're ready to get it going. But General Wascom, if you would.
Yes, sir.
Yeah, thank you for the question. And yeah, as the governor mentioned, I often joke with the governor he should work for FEMA because he knows a lot of their policies and programs, since we've had to deal with it so much in the last 5 years. But to answer your question directly, on Florida Boulevard, my recovery section is housed in the bottom floor of the old Godshaw's department store building. The second floor is FEMA. We've got 21 open public assistance disasters going all the way back to Katrina, so they have never left. The hurricanes that came all the way through the state, Hurricane Laura, that even impacted some of this portion of the state, we're involved in doing that work in the restoration and recovery piece. What the governor mentioned is, if we reach a threshold on the public assistance permanent work for the cities and municipalities, and that's a certain level of damage, obviously that damage has to be captured in monetary terms to meet that threshold. Once that happens, we make the declaration request, the governor does, to the President of the United States through FEMA. If they agree, they turn that on. That will then trigger preliminary damage assessments, where the FEMA folks, our folks and the local folks with DPW and OEP offices will get out, take a look at that, we'll agree on that, and we'll start writing project worksheets to get that money flowing. With most things FEMA, you have to spend the money to get the money. It's a reimbursable program like the governor mentioned. It's 75-25 normally, unless you reach a higher threshold. So briefly, that's the case. With the individual assistance piece, there's a number of different thresholds for that. It's not necessarily a monetary threshold, but first thing we have to do is we have to capture how many households, low income, usually low to moderate income, have damage and repairs. And so there's a number of questions. The governor mentioned a survey we'll be sending out. We used it for the hurricanes. It's a database we use to capture that, which will help us, the governor, make the argument to FEMA to turn that on for people who need it. So thank you for the question.
And then if there's enough insurance available to pay for those damages, then you may not get the assistance. Yeah, so there's a lot involved here, and we go through this with some frequency. But any other questions?
My last question.
Yes.
Besides the, you said 500,000 bottles of water that you guys have already been delivering, what other help can locals receive on a state and government level, and for how long?
Well, what we want to do is have locals paying attention to the information coming out of the Offices of Emergency Preparedness, because going forward there will be information about potential distribution of water, but other things that they may be requesting of us. There was some mention a while ago that may be some MREs, because we have a number of stores and restaurants that are closed still, because it could be because of the road conditions. If so, they're going to be open pretty soon, but it might be because they don't have water, in which case they're not going to open that soon, or they may be under a boil advisory and have decided not to open for a while. So if you pay attention to the Offices of Emergency Preparedness, they're going to tell you what's available and where it's available and the hours of operation. And I don't want to get in front of those OEPs. So that's both for Caddo Parish and for Bossier Parish. That's the assistance. And by the way, we know that's what people need right now. I mean, we're hearing that from legislators, from city council people and commissioners and so forth. Right now, it's all about water. Electricity's been restored, and we can be very, very thankful for that, although that's not true across the state. There's still about 43,000 outages, primarily centered in about 12 states. And the challenge there is, after a hurricane, you kind of know that if you get the infrastructure fixed in a certain area, it's going to turn on a lot of people at one time. These are small outages that are interspersed across a large geographic area, and so you actually have to dispatch crews to all of those. But that's happening today. The weather is better. The crews are able to get where they need to get to, and I believe that for the rest of the day, we're going to see the majority of those 43,000 outages restored. So I want to conclude now, much like I did to start, and that is by thanking all of the people who've been working so hard, including Colonel Davis, who I misnamed a while ago, and I wasn't even thinking about it. Lamar Adams was the basketball player. Lamar Davis is the superintendent of state police. So I apologize for that. But anyway, thanks everybody for the work that you all are doing and making sure that the people have good, accurate information to rely upon. Do pay attention to the weather forecast. Again, freeze tonight, not tomorrow night, and then freeze again on Monday night. Be very careful when you get out on the roads, especially tomorrow morning with respect to black ice. Be careful when you start to make repairs around your home or business, because you might have a roof that collapsed because of snow or something like that. And quite often people injure themselves when they start trying to clean up and to fix things. Carbon monoxide poisoning, something to always be very careful about. And let's be patient and be good neighbors to one another. And please still check on your neighbor, especially if they're older. Make sure that they're warm enough, make sure that they're fed, make sure that they have water, and do what you can to help. We will be delivering resources as requested and as we're able for the duration of this event. And we know that when the sun comes out and it gets above freezing, this event isn't over, because we have to have these water systems back up and running. So thanks all of you for the work that you're doing. Thanks to the people of Louisiana. Let's continue to lift one another up in prayer as well. And I'm, for one, am grateful that we have so many really good public servants at the local level, at the state level, and quite frankly at the federal level that we work with as well. It really is a blessing when you need them, and we need ours here in Louisiana much more often than we would like, because of floods and hurricanes and ice storms and so forth. But thank you all very much, and we'll get back up here just as soon as we are able and the situation warrants, and I fully expect that the next time we're up here we'll be administering vaccines again, we'll be testing for COVID again, and we'll have the water pressure restored so that we can get back to normal. And we're going to work around the clock to make sure that we're delivering the resources that we can to make that happen. Thank you all. So that's the comment that you have. I couldn't even figure out what you were talking about.